So imagine that we were all getting ready to go on vacation, head to the airport, and we get to the ticket counter. And upon arriving at the ticket counter, we find out from one of the workers that 40% of the planes don't make it to the desired destination. Is there anybody here that would get on that plane? I didn't think so. But that's exactly the deal that we're serving up to millions of kids all over this country in our education system. 40% of our kids aren't graduating, and we know that for kids that are kicked out of school, 60% of them are going to touch the juvenile legal system. And for many of our young people that are locked up, even right now over on East Alder, most of them are in there for crimes of violence. And generally, most often, it has something to do with a gun. And so we want to address the cultural addiction that we have to prison, to addressing a broader issue that's related to violence in our community. This is something that's personal for me. This isn't a 9-to-5 job. I actually lose sleep waking up every day concerned about child well-being and how do we create the conditions in our community that allows young people to have both equitable quality and quantity of life. And so I'm grateful for the opportunity really to be able to coalesce and to bring together a bunch of community-based organizations, a bunch of folks who work within the system, and a large amount of community members who have all come together to say, let's move away from competition and what would it look like for us to have collaboration. And this birthed the Regional Peacekeepers Collective. Community coming together on behalf of community to do what's on the best interests of our young people so that they can grow up in spaces that are happy, healthy, safe, and thriving. And what we need are long-term investments into this work, because while we're focused on what we need to do to make sure that young people aren't dying tonight, we also want to be able to institutionalize this work in such a way that we're not having the same conversation 15, 20, 30 years from now. And so, with that said, I think it's essential that we continue to recognize that what we're raising up and what we're producing is a new kind of public health worker. And we want to make sure that these public health workers who have the vaccine to cure the disease of violence are able to get this vaccine out into our communities, that we're able to turn the curve, and that we can conquer and overcome this disease of violence the same way that we've done, right, with COVID-19. And right here in our own county, our county executive and the director of public health, they declared racism a public health crisis. Acknowledging, right, that the longest disease that we've had to deal with in this country is COVID-19. And so as we intentionally recognize through public health that racism and that gun violence are intertwined, right? And that there's a deep-seated connection to it. And so we want to hold the tension of recognizing that we've got to address these social determinants of health that are impacting our young people. Otherwise, these amazing organizations go out into community, they do great work, but then they have to send young people back into the same environment that made them sick in the first place. And so we've got to change and transform the environment, and that requires all hands on deck. That requires an ecosystem where we all recognize the role that we play, and while everybody can't do everything, everybody can do something. And so this Regional Peacekeepers Collective is just that. It's everybody coming together and recognizing ultimately that we are better together, that there's trauma that has to be addressed, that we've got to heal, and that we have to come together in order for that to happen. And so I'm grateful for each and every person that's in this space today as we do the work of violence reduction and of harm reduction just by passing out these lock boxes. But that we also don't downplay what's happening right here in our own backyard, because I feel like sometimes we go, well, we're not Chicago, you know, or well, we're not Baltimore. But per capita, black folks only make up 6.84% in King County. And so if 50% of the folks that are shot are black men, what does that mean when you think about per capita, the violence that's happening to black folks right here in our own county? We've got work to do, and we've got the vaccination. We just need the kind of investments to ensure that this kind of work can continue to be carried forward, and that it goes beyond just an election cycle, or that it goes just beyond a few years, or that it goes beyond some director or some program manager. We need sustainable efforts to ensure that this work can carry forward. And that's important. So that means that we have to value life more than we value fudge and numbers for reports. That's really what this work is about. It's about valuing life. And we want to value the lives of the young people because they deserve the right to live and to not be afraid. Teachers can't teach in places where there's violence. Hospitals can't manage high levels of violence, particularly during a time where there's a high rise in COVID. And businesses can't thrive, nor do they want to be in places where there's high pockets of violence. So we've got to start with where we are, which is with addressing the violence that's in our communities. We see gun violence as a go-first strategy. We're not ultimately trying to live here. We want to make sure that we're able to provide our young people with a technique, because we know that by giving them a technique, it will allow them actually to be able to put down the Tech 9. And so we're grateful for everybody that's in space today for this collective work. There's so much work to be done, but I'm grateful for the commitment and for all of the folks that are in space that have committed to doing just that.